I enjoy the art and science of dentistry so we can make teeth look beautiful, but also we can fix them and help people's overall health get better. So I like the combination of both those. We'll do some cosmetic dentistry and make people have beautiful smiles and then change their life. That's one way we help people, but also we can help their gum health and their teeth health and have them have a much better overall health and oral health.
All right, we're here with Dr. Michael Carley. Do I pronounce that right, Dr. Carley?
Yeah, it's Michael Carley. You got it right.
I got it right. Well, all right. So, Dr. Carley, what made you actually going into the dental industry? What made you becoming a dentist? It's always kind of like an intriguing thing to ask people why they do a certain profession, especially if it has to do with making people healthy. Maybe some people don't know it, but dentistry is not exactly an easy profession to work, on a millimeter type of tolerance every single day. And that not with metal or something which doesn't scream, but with people who move and who have emotions. So what makes and it's so artful and so technical. So what made you wanting to become a dentist?
Yeah, I enjoy the art and science of dentistry. So I always did well in science and math and but I also take ceramics classes and in high school and college and I enjoy the art and science so we can make teeth look beautiful, but also we can fix them and help people's overall health get better. So I like the combination of both those. We'll do some cosmetic dentistry and make people have beautiful smiles and then change their life. That's one way we help people, but also we can help their gum health and their teeth health and have them have a much better overall health and oral health.
Well, wonderful. So yeah, they study, the artistic art of dentistry, um, because, $1 million smile, as it is like said so often, a Julia Roberts smile, a Tom Cruise smile, it's literally worth, not to all of us, it's worth millions, but I do believe it's worth a job. It's worth the pretty girl. It's worth the handsome guy. It's worth the, I don't know, the table at the restaurant. Uh, it's the tip that if you're a waitress or something like that. Um, it must be nice to kind of like put that smile on people. You must have heard people coming back and say, or did you? It's a question. Did you? Do you
Yeah,
have?
we found your whole life can run a little smoother if you have a nice smile. If you're passed up on a job opportunity because you have a broken teeth, if you don't get to talk to the pretty girl next to you because you're broken teeth or you're embarrassed. Sometimes people don't even want to talk if they have unhealthy mouths. So we believe in getting them back to health and having a great social life, great business life, great home life. We want all three of those to be great.
No doubt about it. People, and unfortunately, after a long time, they might not anymore realize it. By long time, maybe a few weeks, a few months, and often, unfortunately, years. That people are they pulling their lips over. They don't opening. They speak like this, and they think it's just that it all came from maybe a little brown, a little yellow, a little chipped, a little crooked, whatever it may be, a little bad breath, and don't know how to get rid of it. And next thing you know is their behavior is just simply not that of a confident person, right?
Yeah, we've found that if they have untreated or neglected dental teeth, that can lead to pain, frustration, and embarrassment.
Well, all right. So now we know why you're a dentist and that you are in Santa Barbara, where there's ocean and mountains all together. Great, wonderful. Now, um, you mentioned a lot about pain, illnesses, and the aesthetic. We talked already a little bit about the aesthetic of it and how important it is. I assume something people even know less about from just by talking to lots of dentists and saying is, for instance, how much a little gum disease, a little bleeding, a little gingivitis, a little periodontal disease, whatever name we give it in terms of how much of it is there, how much that infects the overall health of the body. What a lot of people don't realize is that, for instance, when a person has a major operation, that surgeon sends the person to a dentist like you and says, get a clean bill of health. Not for beauty. He's not interested in a chipped tooth, but he's interested in something else. Why? Because it weakens the body. Tell us about that part, because I do think a lots of people are missing this part. Even dentists, I find out, are kind of like, promoting that you will eventually lose your teeth. Bad thing, no doubt about it. Um, but you dentists also are very, 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 very good in replacing teeth. So it's not the end of the world anymore. Do you understand? It's not like George Washington, who apparently had a wooden tooth or some such thing in it. That must have been awful. But what happens until you lose those teeth, uh, seems to be way more devastating and not talk enough about.
Yeah, the research shows that the more bacteria you have in your mouth, the less healthy your gums are, the more likely you are to have complications in any surgery in any part of your body. So we do work with orthopedic surgeons, and yeah, they send the patient to make sure that their gums are healthy, their mouth's healthy. They won't even do the surgery. There's stories of people having uh, uh, a new knee or a new shoulder, a new hip replaced, and they've had to do it 2 or 3 times because of infection, and then they're like, "Why is it getting infected?" And finally, somebody found out that they just had so much bacteria in their mouth that was getting into their bloodstream and infecting those joints. So the mouth health is very important for healing from any surgery.